Hello, Ergo-Flex family. I'm Dr. Robbie Wyatt, Chief Clinical Officer at Ergo-Flex Technologies, home of the Back on Track, Knee on Track, and Total Brain and Body O2. Now, I want to talk to you about how to actually build a treatment plan. So, there's a lot of different ways that you can do this. There is the way that many chiropractors operate, and it's the come and see how it goes. We're going to see you for 6 to 8 visits, and then figure out where we go from there. All right. It's an interesting, I'll say interesting, because what happens in those particular treatment plans is we're so good at getting people out of pain that after 6 or 8 visits, either the pain has significantly reduced, which basically erases the patient's want to come in and continue to pay money, or the pain hasn't changed that much and they're questioning why they open their wallet every single time they come in and pay you. Okay. Now, when we look at the actual research and the physiology and take a look at something called fibrosis of repair, now pull out your your old Guyton book from school if you still have it, which I do. Or just get on Google and start looking at fibrosis repair, specifically what happens to soft tissue, muscle, ligament, tendon, so on and so forth. And you begin to understand how long it actually takes for the human body to repair itself. Now, I've had family members and I've had many patients that unfortunately have undergone some type of fusion. And when you talk to orthopedic surgeons about their timeline on what they allow their patients to do post-surgical in a spinal fusion, whether it be cervical, thoracic, or lumbar, the minimum time before they allow that patient into physical therapy, and I mean not lifting more than 10 pounds, getting up and moving around their house, not doing much of anything else, is 3 months. Why is that? Because it takes 3 months for the body to not only tear down the tissue that's been damaged in that surgery. In the first month, you're just putting down new scar tissue and new soft tissue. Unfortunately, putting it down like pickup sticks. Okay, it's not well organized. Right? Then the second month, you're actually starting to repair those fibers that have been damaged. In other words, you're starting to put in new collagen, new muscle fibers, while it's still working around the scar tissue that's in place. So that's 2 months in. The third month is all about strengthening those fibers that are now in place. Now, by the end of the third month, when you get to the fourth month, those fibers are still juvenile, untested fibers, okay? Especially if they haven't been doing anything. So here's my analogy. Imagine you take a 35-year-old roughneck off the oil rig out in the middle of the Gulf, and you plop a 12-year-old boy in his place. Ask him to do the same job on the same 12-hour shift at the same pace. Does anybody believe that that 12-year-old boy is going to be able to keep up with the 35-year-old roughneck? No, he's not conditioned to that. Nor could you get him conditioned to it. He can't physically handle the labor that a 35-year-old man can. All right? That's what we're asking fibers to do at the 3-month mark, or at the end of the 3-month mark. All right? We're asking them to do the job that we had perfectly healthy, strong, well-aged tissue before the injury occurred. Right? So what does that mean for our treatment plans? That means that we as doctors should be informing our patients of this process, okay, and exactly what we need to do for them to get them healed up. So that means that if you look at the ODG guidelines, the ODG guidelines talk specifically about doing 3 times a week for 4 weeks in physical therapy. That includes manipulative therapy, chiropractic adjustments, so on and so forth, and reevaluate. It doesn't say stop. It doesn't say don't continue. It says reevaluate and continue as needed. Okay? So and it says do another 3 times a week for 4 weeks. Reevaluate and continue as needed. All right, this is the ODG guideline. And by the way, it says that you should actually reevaluate every 2 weeks once you get past the first 4 weeks. Now, if I'm off on this, you can call me out on it, but this is my best remembrance of it. I've been looking at it here pretty closely here recently. After the first 4 weeks, every 2 weeks you should do a reevaluation, but every 4 weeks after the initial 4 weeks, you do evaluation. You make a decision as to whether you move forward as needed. Okay, so that means that every month you're doing a complete reevaluation and seeing where the patient needs to be. Now, specifically how you use the back on track and knee on track in this process, and personally for me, what I did for my patients from a chiropractic adjustment standpoint was I built care plans in 12, 24, or 36 visits over 1, 2, or 3 months. Now with the back on track and the knee on track, what we found was that we were initially doing 3-month, 36 visit care plans. That's 3 times a week for 12 weeks. Okay, that was chiropractic and myofascial release. There was no other forms. There was home care. Go do these exercises. They got 3 because we found they could never do more than 3 at a time. Okay, so they got 3, and then every reevaluation they would get 3 more, as appropriate. Well, when we put in the back on track and the knee on track, what we found was that last month of care wasn't really needed. Okay, so I went to a 3 times a week for 8-week program for all of my back on track and knee on track patients. That gave me enough time. So in other words, we were able to break down tissue. Okay, if we didn't have a new injury, which typically those weren't brand new injuries, we were able to break down tissue. That happened in the first 2 weeks. Okay, we had a reevaluation in those first 2 weeks. Check to see where they're at. Okay, now we've torn down fibers. Now we're starting to replace fibers. All right, so you tear down fibers through the motion, through the adjustment, through the myofascial release. You're breaking up scar tissue that has been laid down improperly, realigning it. Okay, that's typically when patients start feeling the best. They get great pain relief. Well, if you don't have a plan or you haven't educated that patient past that event, and more importantly, you haven't collected money past that event, guess who stops care? The ones that don't have any pain anymore. It's the worst time they can stop care because we don't even have good juvenile fibers in place. They're just starting to be put down in repair phase. Okay, just barely starting to get put down in repair phase. Okay, so you got tear down phase, you got repair phase, and then third phase is strengthening phase. Okay, so the tear down phase typically takes 2 to 4 weeks. Repair phase, 2 to 4 weeks. Now we're 2 months in. Okay, and the strengthening phase occurs in the next 2 to 4 weeks. All right, so we break down the fibers, reorient the fibers, get them out of pain, and we start that strengthening process. Okay, so 3 times a week for 8 weeks on our back on track and knee on track patients. Okay, with adjustments in myofascial release and home care. Now, we hit the 3rd month, it's time to start strengthening them. So we pumped up their home care. Eventually what we did was, that's not good enough. We need to make sure they're doing in-house physical therapy. Stretching, not just stretching, that's what starts at the beginning, but strengthening. Now we add a strengthening phase into their, not only their home care, but in-clinic care, 15 to 20 minutes, 3 times a week when they come in. Okay, that's a part of their actual strengthening phase. All right, so when it comes to physiology and how it actually works, a 2 to 3 month program is what is required in order to truly get the patient healed up. Now, remember, at 3 months, we still have juvenile fibers. They're not strong, strengthened, aged fibers. They're juvenile. They're still prone to injury and re-injury, right? So that's when patients can start to gently start going back into their actual exercise programs. Now, not full bore, now what they were doing 3 months prior at a modified rate. All right? Now, we understand through fibrosis of repair, again, referring back to Guyton, it takes a full year for those tissues to completely strengthen up and heal around scar tissue. Okay? That is well organized. If you have unorganized tissue, it's very painful. So the longer that unorganized tissue, scar tissue is in place that hasn't been well organized, the longer it takes a patient to get better. Okay? And a lot of these are post-surgical patients. All right? So you have options. You can do pain relief care and get people in between the 6 to 12 visit mark within the first month out of a lot of pain with this system. But you're only doing a third of the job you really need to do. So building care plans and corrective care plans around well-known physiology is critical. Educating the patient on that process, selling them on why you're the person that's going to fix them, and then actually bringing that sales process to a close and collecting money as appropriate to that entire process. Okay? If you have any questions about this, reach out to me on the Ergo-Flex Facebook page, Chiropractic Instruments of Success page, or you can reach me at dr.wyatt@backontrack.com. Don't forget, March 22nd, 23rd, we have Secrets to a $1 Million Practice. I'm going to be talking about some of these specific protocols and techniques I'm talking about today and how I got my patients better, much faster pace, and was able to actually shave off an entire month on my care plans and get patients back into their life and what they love most. Again, that's March 22nd, 23rd. Seating is limited. We have early bird specials that are going on right now that are about to expire. So call, get your ticket for Secrets to a $1 Million Practice, March 22nd, 23rd. Have a great one. Keep saving lives.